Oncological rehabilitation, physical therapy and rehabilitation, lymphedema treatment. Module content. Module outcomes. Aim of the module. What is the lymphatic system? What is lymphedema? How to treat lymphedema? Manual lymph drainage. Compression therapy. Respiratory therapy. Hygiene and self-care rules of the affected limb. What should be considered in daily life? At the end of the module, patients and their families know what lymphatic system is and its role in the functioning of the body. What lymphedema is and how it can be treated correctly. Rules of hygiene and self-care of the affected limb. Exercises to recover the limb affected by lymphedema. This module aims are to bring useful and practical information to cancer patients and their relatives regarding medical rehabilitation in cancer. To provide, in particular, information about physiotherapy and its role in cancer rehabilitation, lymphatic system, prevention and treatment of lymphatic edema and specific exercise program and manual lymphatic drainage techniques. For patients to have access to appropriate medical rehabilitation so that they are less dependent on others and optimize their quality of life regardless of their life expectancy. What is the lymphatic system? The lymphatic system is a drainage system, which works in parallel with the venous part of the circulatory system and has a major role in the detoxification process of the body. It actively participates in the balance of body fluids and acts as a defense against infections, being named the guardian angel of the human body, and the lymph is also called the white river of life. On the path of the lymphatic vessels there are many lymph nodes. The lymph nodes are more numerous in the chest, neck, pelvis, armpit, groin, and intestine. The functions of the lymph nodes are many. They produce lymphocytes, form a barrier against microbes by producing antibodies, actively and effectively intervene in the body's defense mechanisms against infections and diseases, for example, cancer, stop some foreign substances that want to enter the body, defense, and role in lymph filtration, which is one way, from the periphery to the center. If the lymph nodes are removed, they cannot regenerate. What is lymphedema? Lymphedema is a mechanical insufficiency of the lymphatic vascular system. Lymphedema is a chronic condition and the consequences can be serious. The physical manifestations of lymphedema reduce the patient's ability to perform the tasks required for daily living, such as dressing and writing, or mobility if the leg is affected. The weight and discomfort of the swelling reduce mobility and can lead to social isolation and depression. The pooled fluid is an ideal medium for bacterial growth. How to treat lymphedema? The most well-known and effective method of treatment is combined decongestive therapy, CDT, which consists of manual lymph drainage, compression bandage, compression stocking or glove, skin care, respiratory therapy, specific exercises for lymphedema, manual lymph drainage. Manual lymph drainage, also called lymph massage, is a special manual technique that primarily acts on the lymphatic system and facilitates the elimination of excess interstitial fluid. The technique involves two different things: the absorption of fluid by the vessels, almost from the veins in the lymph, and the directing of the lymph to the larger measurement. The pressure is adjusted for each case and according to the severity of the lymphedema. Each movement starts slowly. The increase and decrease in pressure is done slowly without pressure. The treatment time and repetitions of each movement depend on the condition of the tissue. Lymphatic drainage does not cause redness or damage to the skin. Compression therapy. Compression therapy by applying compression elastic bandages to the affected extremity and wearing medical compression stockings. Application of compression elastic bandages support the activity of therapists in reducing edema, improve muscle pumping and joint mobility. Together with manual lymphatic drainage disperses accumulated deposits in the connective tissue and prevents the reaccumulation of the evacuated lymphatic fluid. Compression therapy. Compressive medical stockings exert effective, therapeutic pressure in tissues, lymphatic vessels, and blood vessels. Contraindications: bandage. Cardiac edema. Severe heart failure. Venous thrombosis. Infection, erysipelas cellulitis. Skin metastases. Nerve damage and pain. Patients with diabetes associated with neurological problems. Rheumatoid arthritis. Respiratory therapy. It is recommended that the exercises be performed daily, 5 to 10 minutes each. They have a calming and relaxing effect, stimulate the lymph and help the patient cope with everyday stress. Stressful situations have an adverse effect on lymphedema. Another respiratory therapeutic procedure is the half-moon position, a specific positioning technique with lateral torso flexion and shoulder elevation. 13. Slide hygiene and self-care rules of the affected limb. Care of the upper limb, arm, lower limb, leg. Use AP neutral shower soap gel, 5.5, or lotions, moderately moisturizing, odorless body creams. Wash hands frequently to avoid infections. Increased attention to the area between the fingers, for the prevention of mycoses, etc. Use a soft towel with good absorption, without rubbing, avoiding irritation. Avoid scratches, cuts, insect stings, burns, limb trauma. Increased attention to manicure-pedicure. It is contraindicated to cut the skin and damage the skin. An individual shear shall be used, which shall be disinfected each time before use. Nails are shortened using the nail file. Hygiene and self-care rules of the affected limb. Clothing. Choose clothes and underwear from natural, cotton, long-sleeved, sunscreen, materials that do not obstruct the arm-groin area. The sleeve and shoulder part should be as light as possible, the belt to be as comfortable as possible. Use of prostheses of appropriate weight. For the affected upper limb, avoid wearing corsets, tight bras with thin straps that prevent free breathing, especially deep breathing. The bra strap should be wider, soft, special with a sponge, and the bra cup should be matched to the size. Hygiene and self-care rules of the affected limb. Clothing. It is contraindicated to wear the watch, bracelets, rings, wedding rings or other jewelry on the arm with lymphedema. It is forbidden to wear the purse on the side of the affected shoulder. For the affected lower limb, wearing appropriate, special, orthopedic footwear, possibly with a heel, not to be tight, without high heels, not more than 5 centimeters. It is forbidden to walk barefoot to prevent injury. Avoid exposure to sun or other heat sources. Hygiene and self-care rules of the affected limb. Medical interventions. It is forbidden to collect blood, injections, perfusion, measure blood pressure on the arm affected by lymphedema. Acupuncture and acupressure in the arm lower limb are not indicated. Visit to the doctor as soon as possible in case of skin lesions, insect or needle stings, gardening accidents, etc., or at the first signs of mycosis, red hives, yellow and sensitive nails, cracks in the fingers, or signs of chills, redness of the skin, subfertility and pain on the limb. Classical massage is not indicated on the lymphedema arm. Tightening, forcing, hitting, pinching are prohibited. What should be considered in daily life? Avoid lifting and carrying weights of more than 1 kilogram. Avoid overloading, such as washing windows, hanging curtains, and laundry with the affected arm. Sauna, hot bath, sun exposure is not indicated. Hot and humid regions, where there are many insects, should be avoided. Scratches, animal bites should be avoided. In gardening, use gloves. The seat belt in the car should not be tight. Attention to the arm. Long journeys require rest periods. The member, if possible, should be slightly raised. Crossing the lower limbs for longer is prohibited. Avoid bending the arm or knee and hip for a long time. Avoid bending the knee, hip for a long time, if the lower limb is affected. What should be considered in daily life? Sports indicated: swimming, in fresh water, sea, walking. Sports that overburden the member: tennis, football, canoeing, jogging, climbing, skiing, should be avoided. Walking Scandinavian with 2 special sticks. In addition to swimming, It is the only sport that is recommended in lymphedema, activates 85% of the body muscles, stimulates lymphatic circulation and improves breathing. Daily exercises activities recommended by the physiotherapist occupational therapist should be performed.